Hello everyone, my name is Megha Prasad and I'm here with ACC Fits on the Go blog. We're in Orlando, Florida at AHA 2015. I'm joined by Dr. Sharon Hayes, who's a professor of medicine at Mayo Clinic in the Cardiology Division and also the founder of the Women's Heart Clinic. Thank you so much for joining us today, Dr. Hayes. Can you tell us a little bit about the gross underrepresentation of women in the field of cardiology?
Well, we are grossly underrepresented. I just saw recent data where actually urology has a higher percentage of women in their training programs. It's important that we address this not just to make it better for women, but we've got a future shortage of physicians and cardiologists, and we need to draw from the best and brightest of both men and women as we train cardiologists. I think historically people have thought that cardiology was really hard and it might not fit very well with family plans or other things, and you have to get that critical mass. But what I would say is cardiology is such a cool thing to do, and I encourage all young women to think about it because there's so many aspects of cardiology.
That's true. I've just started my first year in fellowship and I've been lucky to have many great female mentors. Can you talk a little bit about the importance of having female mentors for female cardiology trainees?
Well, first of all, it's really important, but almost more, I would say, role models, because anyone can mentor, and there's too few women in cardiology to expect that every woman will have a female mentor. So one, I would say, important for role models, important for perhaps that kitchen cabinet of mentors. So maybe have a scientific mentor who's a guy who's an expert in his field that you're interested in, but maybe you've got somebody who's more of a career mentor who's a woman who may have been through some of the same things, whether it's work-life balance. So I think mentoring and role models are important.
We know that there are very few women that achieve the rank of professor in cardiology, and you've been one to do that. Can you speak to those of us that are beginning our training and aspire to achieve that rank one day, how you did it?
Well, I would say I was a late bloomer. And so one of the things that academic medicine is very challenging to women in medicine, not just cardiology. So we are expected to be the most academically productive in those first few years after we finish our training. But that's also when many of us are being reproductive. And so looking at several strategies. One, you can't expect somebody who's had 2 or 3 children in 5 years to be as academically productive as somebody who hasn't, but keeping their hat in the ring, being middle author on several papers a year and continuing to contribute. So once your brain is and your family and perhaps your home is opened up, then leaning in or on-ramping again and being fully engaged in research. So I'd say don't lean all the way out or step up the ramp completely. And I think it takes a commitment and mentors and a good team to work with. It is more challenging, but I think this is changing, I hope, for the future, because actually more millennial men are wanting to have some of the same work-life balance early in our career, so I'm hoping that's going to help women as well.
Yeah, I hope so too, for my sake. So Dr. Hayes, could you tell us a little bit about the growing need for women in cardiology given the late bloomers?
Well, I think one, cardiology, we need all types of people caring for all types of people. And so that was where we need more women and minorities in the field of cardiology, because it will enrich our field and make it better. We'll be smarter, because with diversity coming into medicine, we'll have better solutions for our patients. So I think that's number one. It's not just being, the right thing to do. It's going to be better for our patients. I think the other part of it is making medicine in general, and cardiology in particular, more livable. The expectation that medicine is going to be your life as opposed to your career, we've really got to step away from it, because you can't sustain 80 hours a week for the rest of your career. So there's a number of solutions that are structural, but there's some that are attitudinal, both for the folks, us old folks that are in cardiology now, but also in those who are coming along behind, to change our attitudes and show how things can be done differently, even if it's with less face time and not FaceTime to your kids at home when you're on call, but more time in place. And I think some innovations in the way we practice and deliver healthcare and cardiology will probably make it more approachable for women and everybody.
So if you had to give our women that are watching some advice, what would you give them? A few pearls.
Well, most of the folks that are watching are folks who are already in training, so I don't have to tell you cardiology is a really cool thing to do. But I would just say to explore and be true to yourself, but don't give up on yourself just because it's hard. I do think sometimes, particularly women who are often the only female trainee in their program, or they're few or no female faculty and don't have those role models or mentors, reach out across the FIT network, reach out, go to national meetings, and go to the meetings where you've got the Women's Congress, whether it's ACC or AHA or at Heart Failure, so you can connect with and network with folks outside. Sometimes your best mentors are in a different department in your own institution. Don't think that perhaps the female gastroenterologist or the female orthopedic surgeon, they might have something really to offer you in a common experience. So network, persistence, and creativity, and women are really good at that.
That's great advice. I hope we can all follow it. Thank you so much for joining us today, Dr. Hayes. For more videos like this, please go to www.youtube.com/fitsonthego. Thanks for watching.